Inside our bodies, even the smallest components play a vital role. Take the gallbladder, for example, a small sac tucked under the liver. It might seem insignificant, but it has a big job storing bile, a fluid that helps us digest fats. Sometimes this process goes awry, leading to the formation of gallstones. Imagine hard, pebble-like formations developing inside the gallbladder. These are gallstones, and they can range in size from a grain of sand to a golf ball. Composed primarily of cholesterol, these stones can silently reside in the gallbladder, often without causing any noticeable symptoms. However, their presence can lead to significant discomfort and complications if they begin to move or grow larger. The formation of gallstones is a complex process, often linked to an imbalance in the substances that make up bile. While some people are genetically predisposed to developing gallstones, lifestyle factors like obesity and rapid weight loss can also increase the risk. Understanding the nature of gallstones is the first step in recognizing the potential health concerns they can pose. For many individuals, gallstones remain silent passengers, causing no noticeable discomfort or disruption. However, as these stones grow larger or begin to move within the gallbladder, they can trigger a cascade of symptoms. These symptoms are often subtle at first, like whispers of pain that are easy to dismiss. One of the most common signs of gallstones is a dull, aching pain in the upper right abdomen, often occurring after a fatty meal. This pain can radiate to the back or shoulder blade, mimicking other conditions and making diagnosis challenging. Indigestion, bloating and nausea are also frequent complaints, leaving individuals feeling uncomfortable and unwell. Because the symptoms of gallstones are often vague and intermittent, they are easily mistaken for other digestive issues. Many individuals attribute these warning signs to stress, indigestion, or other benign conditions, delaying necessary medical attention. Recognizing the potential significance of these subtle symptoms is crucial in preventing the progression to a more severe and debilitating condition, a gallstone attack. While some individuals experience mild and intermittent symptoms from gallstones, others face the sudden and intense onslaught of a gallstone attack. This agonizing event occurs when a gallstone obstructs the cystic duct, the narrow passage connecting the gallbladder to the common bile duct. Imagine a sudden, sharp and excruciating pain that grips the upper right abdomen, radiating to the back and shoulder. This intense pain, often described as one of the most severe imaginable, is the hallmark of a gallstone attack. Unlike the fleeting discomfort of indigestion, the pain of a gallstone attack can persist for several hours, leaving individuals writhing in agony. Nausea and vomiting are common companions during this ordeal, adding to the overall distress. The severity and sudden onset of these symptoms make a gallstone attack a truly frightening and debilitating experience. The excruciating pain of a gallstone attack often sends individuals rushing to the emergency room seeking immediate relief. While pain medication can provide temporary respite, definitive treatment often involves surgical removal of the gallbladder, a common and generally safe procedure. Understanding the urgency of seeking medical attention when faced with the debilitating symptoms of a gallstone attack is paramount in preventing potentially life-threatening complications. While gallstones residing within the gallbladder can cause significant discomfort, their journey outside this organ can lead to more serious complications. Imagine a gallstone escaping the gallbladder and lodging itself in the common bile duct, the channel responsible for transporting bile from the liver to the small intestine. This obstruction can have far-reaching consequences, disrupting the normal flow of bile and impacting various bodily functions. One of the most striking signs of a blocked bile duct is jaundice, a condition characterized by a yellowing of the skin and whites of the eyes. This yellow hue arises from the buildup of bilirubin, a pigment normally processed by the liver and excreted in bile. When the bile duct is obstructed, bilirubin accumulates in the bloodstream, giving the skin and eyes their characteristic yellow tint. In addition to jaundice, a blocked bile duct can cause pale stools, dark urine, itching, and fever. These symptoms, often accompanied by the unrelenting pain of a gallstone attack, signal a medical emergency requiring immediate attention. Prompt diagnosis and treatment, often involving endoscopic procedures or surgery, are crucial in restoring the normal flow of bile and preventing potentially life-threatening complications like infection and organ damage.